I would like to ask you about how do you actually define what exactly is premature ejaculation? How do you define what a premature ejaculation is? Because as you also know, it is tied to a sense of masculinity for many men. But isn't this word premature ejaculation a kind of a misnomer? How do you really define somebody with premature ejaculation? What is coming too fast?
Sangeeth, premature ejaculation is really, in so many ways, a mystery, in that we don't know how to define it, we don't know where it comes from, and we don't know how to treat it. Okay. Now, I'm saying all that to sort of lower expectations, but we actually do know some things. It used to be that premature ejaculation was defined as having your orgasm before your partner during intercourse. But then that brings up the bit of a conundrum, which is, well, what happens if your partner is anorgasmic? Does that mean that if she cannot, we're talking about heterosexual couples, if she cannot have an orgasm, does that mean you are by definition a premature ejaculator if you at any point have an ejaculation? So in a sense, that definition doesn't work well. That if you just come before your partner, then you're a premature ejaculator. And then we have numbers that we attach to it. Oh, well, if it's within seconds or within minutes. I once had a gentleman come to me, and he was very disappointed. He was a very came from a royal family in a country, and he felt that his obligation as someone of royal lineage, that the idea that he had an orgasm before 45 minutes meant that he was somehow a disappointment to his royal family. Well,
45 minutes.
Yes, your audience could laugh at that, right? And say 45 minutes, So it really, the definition can be so fluid. So we've currently been thinking, somewhere between 6 and 8 minutes, but even that's not a very good definition. It's because, so what are you doing in those 6 to 8 minutes? Are you thrusting like a jackhammer, or are you thrusting slowly, or are you not thrusting at all? What does this all mean? So you can see that it's very difficult to say what constitutes premature ejaculation, except perhaps the notion of it when you've got it, and that if you feel that you're a premature ejaculator, well, then maybe you are, or as I said, that can then talk a lot of people into having a problem that they really don't have. So, as I said, I'm trying to squirm out of your request for a definition. It is very hard to define it. So then we ask, well, then how prevalent is premature ejaculation? And the answer to that is, well, it's hard to say. Some people, as I just said, might talk themselves into having PE, premature ejaculation, when they really don't necessarily. It might be situational. And that's something that I would like to focus on. When are you prematurely ejaculating? Is it with a particular partner? Is it on a set of circumstances? Is it is it determined by who your partner is and what she is doing? Or does it have to do with something that you're doing? Does it occur under circumstances where you're alone and just masturbating? What are those circumstances will help us as we try to think about what problem do you have and how do we address it? And that brings me to the last thing, which is, okay, so if we don't know about the prevalence exactly, or if it's very variable, then, well, how do we treat it? And of course, there are these, if you will, quick and dirty solutions, which is, well, how about these numbing gels that you can take? Or what about these medications which are off-label, at least in the United States, where we might recommend an SSRI, an antidepressant, selective serotonin reuptake inhibitor. And then, or what about just talking about a quick solution? What about just wearing a condom or two condoms or three condoms? Wouldn't that desensitize me and not make me have an ejaculation before I'd like to? So all these are, if you will, to a degree, mechanical solutions, though I grant you an SSRI would be a medicinal solution. But as a psychologist, and someone who specializes in sexual medicine, sexual health, I'd really want to be talking to a person about what's going on in your head. What has this got to do with the relationship with the person that you're having sex with? And how might we address it? So sometimes it's a couple's problem, or sometimes it's an individual problem. Sometimes there are exercises we can ask a person to undergo. We often talk about Kegel exercises as being a part of that. Sometimes a referral to a physical therapist who is a pelvic floor specialist might be helpful. For each individual, it really requires a lot of thoughtfulness as to what a sex therapist like myself would recommend.
What can you elaborate a little more on the Kegel and the pelvic floor exercises? This is something which an individual can do in his own way, right? He doesn't need any direct medical intervention, right?
That is correct. These Kegel exercises, basically, they can be rather, they can be made more or less complicated, but essentially they have to do with exercising the muscle that stops the flow of urine. Or sometimes or some people would say it also involves an exercise which will clench up the anus. And doing that rhythmically and slowly building up the strength of those muscles, that can help a person. So the muscle one uses to impede the flow of urine, that's the muscle one would be using. Also, one would then be using a muscle that one uses to stop a bowel movement, to retard it so that one can get to an appropriate place for an evacuation. That muscle could also be exercised. And by exercise, I mean, you want to, when those are not the circumstances you want to use them, but you just want to use them to learn how to use that, and by repetition, you can strengthen those muscles. Tighten it, relax it. Tighten it, relax it. And the one thing I would caution your viewers is you want to take this slowly. You don't want to say, oh, okay, I just learned that. I'll do it 500 times, and that will not allow me to be a premature ejaculator. This takes days, weeks, maybe even months to become more.
What is the frequency would you recommend the stopping and starting of urination thing?
I would say start with, maybe 3 to 5 minutes to begin with. And then slowly, and I emphasize slowly, please, increase the duration of your exercise regime. Same thing if you were trying to build up other muscles. If you were trying to strengthen your grip, you want to be able to pull on something that is causing resistance, but you don't want to do this endlessly at first. Just a little bit, or else you're going to be hurting yourself and not really building up that muscle. Or if you're going to be, using dumbbells and just trying to strengthen that muscle, your biceps or your triceps, you want to do that slowly. Don't be cautious. Don't injure yourself.
So if I understand this Kegel exercise correctly, you mean that in that 3 to 5 minutes, start urinating, stop, again start urinating? Is that how you develop the control?
One needn't be urinating. It's just using the muscle.
Okay, just using the muscle.
Uses to stop the flow of urine.
Okay. Okay.
Okay. So no, I'm not saying while you're urinating. It could be, but more importantly, it's just being able to think of this muscle as something that you may not use all that often and be using it all the more. And that has been associated in some people to assist with premature ejaculation.
So,
but again, I emphasize for some people. For others, not so.
Okay. So on an average, you recommend to begin with 3 to 5 minutes and progress gradually, right?
That's right, and progress gradually.
Yeah.
You don't want to hurt yourself. You don't want to cause excessive fatigue. You just want to be able to now know that there's something in your repertoire that might be helpful.
Correct. Also, doctor, another technique which I often have read about is the stop and squeeze technique. How effective is that?
I am not a big believer in that. I don't believe that it is. I mean, it's going to be useful for some couples or a person if he's alone.
Why do you think it is not very useful? I mean, if you can.
Because it isn't. It's not a fun thing to do. It doesn't enhance one's pleasure. That's why I don't recommend using a numbing cream.
It doesn't.
I don't. That's why I do not recommend numbing creams, because what it does, it impairs one's pleasure. Okay. Sexuality is supposed to be for pleasure, and that which is going to get in your way, it's an impediment. So using some kind of mechanical blocker, like multiple condoms, or like a cream, is going to get in our way.
So
if you think about the watchword, sex is for pleasure. And there are plenty of ways that you and your partner can enjoy sex, and it needn't require that there be penetrative sex, and it needn't require that you have an orgasm in a particular sequence. In fact, teaching a man how to delay intromission and how to pleasure his partner will greatly enhance the sexual experience. Also, if the problem is what we call psychogenic, caused by the mind, that the less there is pressure on the man to delay his ejaculation, the more likely, at least in some people, that the problem will resolve itself, the premature ejaculation problem.
It can resolve itself.
Yes, because a person who suffers from premature ejaculation is feeling under a lot of pressure.
Okay.
And that sets up if you will, it triggers the sympathetic nervous system.
Yeah.
And that is often associated with having an ejaculation.
Yeah.
And what we want to do, to the degree that this man can be more mindfully present and enjoying all that builds up to enhancing his pleasure, that's using what we call the parasympathetic nervous system.
Yeah.
And to the extent that he can be focused on that, that will also, in some people, delay the ejaculatory response. What I was talking about in terms of the stopping and starting, that is also a technique that we use for teaching a man to monitor the exertion and the thrusting. And to the degree that there can be a slowing down, I had mentioned before about a jackhammer. One doesn't have to be thrusting as if one's life depended upon it.
Correct.
To the extent that one can slow the pace, can also enhance pleasure, and it can also, for some people, address the problem of premature ejaculation.
Okay. So any other methods which you recommend apart from these two?
Okay. There's another technique. I'd like a man who is experiencing premature ejaculation to recognize that between arousal and ejaculation, there are a number of things happening. And the more that he can focus on the range of the experience that he's having in his genital area and not just in the penis, for example, that there are a number of events that occur, and to the extent that he can focus on them, he'd be able to recognize that there is a sequence, however brief it is. And to the extent that he can focus on that and not on the ejaculatory response, that too can slow the process. Being able to recognize there are a number of intermediary events. But what I want to say is that one way you can appreciate that, or one can appreciate that, is after intromission, that we sometimes use a technique called the quiet vagina, which is that there is no movement either in the man or his partner, that he just lies quietly while inside her, either in a male superior or female superior position, or side by side. The notion is having the penis just rest and appreciate the sensations, the sense of being, of intromission, of being inside his partner with his penis. All that can slow the ejaculatory response. So we often recommend that to a man in terms of slowing the or addressing the problem, as he becomes more and more expert on just what those sensations are, and to enjoy that part of the experience. Sometimes men, especially who are insecure about their erectile response, will, as soon as they enter, they're saying, "Terrific! I've got the ejaculation. I'm sorry, the erection. I'm halfway there," and then so he'll furiously start pumping, and he's going to have an ejaculation so very, very rapidly before, and in that sense, not necessarily having his partner, not necessarily having something to celebrate either. So to the extent that he can accept either a quiet vagina or just a minuscule amount of thrusting, can enhance the experience for both the male and the female.
So, doctor, can you hear
Yes.
me? Yeah. Again, I think the connectivity is going up and down in between. Anyway, so basically what you're saying is, instead of focusing too much on the penetrative sexual act, the endeavor should be to focus on other area of enjoying sex instead of focusing so much on thrusting.
Correct. And what I'm saying is that not only do I want him to enjoy all the preliminaries and to share that with his partner, but then even upon entry, I'm asking him to enjoy that experience as well. The experience of intromission, it needn't be the experience of thrusting until later on in the sequence.
Okay, so when you say intromission, what exactly you mean? Intercourse? Is that what you mean by intromission?
Yes, I'm sorry. Yes, that is what I mean.
Okay. So, doctor, in fact, there are so many men who experience premature ejaculation problem even when they start imagining or fantasizing about sexual act. Why exactly that happens? Even without having a partner around. I
mean, there they are. They're just have a fantasy and they have an ejaculation.
Exactly.
Okay. It does happen, and we don't know. Remember, I told you it's not uncertain etiology. We don't know why some men are, if you will, wired that way, and others are not. And it's for those people that we might want to then enter into masturbatory training, which is helping them to build an erection and having the arousal response and recognizing all the events that occur between having an erection and it culminating in an orgasm. Okay. So again, that requires practice. It requires time. It requires patience.
Okay.
These are the people, if you will, who have the worst experiences with premature ejaculation.
Mm-hmm. So basically, people who experience premature ejaculation even without having actual partner sex are people who experience some form of psychological anxiety, nervousness.
That may well be, or it might be the mix of the, if you will, the physical and psychological. And of course, it's a continuum. You know, there isn't a mind-body dichotomy. Minds are part of the body, and the body is part of the mind. So what we have in those people, in a sense, your neurological self is hijacking your physiologic response, and you're trying to get a little bit more control.
Yeah.
And that's where training oneself with masturbation can be very helpful.
Training with masturbation in what way? Like, can you explain that a little more? How?
Really. One way in which we think we understand the etiology of, at least for some people, of premature ejaculation is that either because of shame or other reasons, a young man, upon first discovering his sexuality, will masturbate and want to do it as quickly as possible. Right. Because, as I said, either out of shame or because they might be discovered if they don't have a private place to do this in, that because masturbation is a covert behavior. Something that's hidden.
Yeah.
So it might be that what this young man has done is he's trained himself to be a rapid ejaculator, and also trained himself to not be attentive to all those events that occur between arousal and ejaculation. So in trying to slow this process down, it requires work on the part of the
masturbatory training
diagnosed with that problem.
Yeah. So even for men who rapidly ejaculate without using a masturbatory technique, just by thinking about a sexual act or a fantasy, for them also this kind of masturbatory training intervention can be helpful. That is what you're saying.
Yes, and that person may well want to be including in that these Kegel exercises, which we talked about earlier.
Okay. Along with that, Kegel exercises also will work.
Yes. Yeah. And again, I'm not big on the squeeze technique. I'm not big on using numbing creams or sprays.
Yeah. Yeah,
I'm just saying.
I find it very refreshing, doctor, when you say that, because most of the people here, whenever I see advices on premature ejaculation, focuses mainly on squeeze technique and numbing sprays and all that. And I think this is a very refreshing viewpoint, which you are saying that, it will inhibit the pleasure.
Yeah. Good. I'm glad that that's come through to you, and I sure hope that your viewers will appreciate that. That if you think about pleasure being paramount, then the other things fall into place, and they're not underscored. A man. One thing, by the way, that I want to make sure I told your viewers is that I want you to appreciate that premature ejaculation is something that we often associate with young men, and delayed ejaculation to an older man, the elderly. So that one thing we can say is that in time, you young man will find that your problem resolves itself.
As you grow old.
Yes. Now, that's not to say that every older person doesn't suffer from premature ejaculation, but I am saying that it can be a maturation process as well.
Maturation process.
Yes. The resolution of it can be a function of maturation.
Maturation.